I gather the appropriate equipment. I will provide privacy. Wash my hands. As you're walking toward the chair, I observed your gait and range of motion. Other than a slight hitch in your step, a little bit of a limp, everything else seemed to be intact. And you don't have the involuntary movements, you're not ticking or jerking. Your general appearance, you appear well groomed, well kept, you've bathed, you're clean, you don't smell. Nutritional status seems to be adequate. Your clothing is appropriate for the season and well kept, clean. Your affect is normal. Mood appears appropriate for the situation. Your speech and hearing seem to be intact. Your skin color is appropriate for ethnicity. You're warm. Nail beds are nice and pink. No striations, nothing inappropriate there. Okay. Your head and face are symmetrical. I'm going to inspect your scalp real quick. It's intact. Normal hair distribution. Don't feel any lumps or deformities. I'm going to check your level of orientation, your alert. Can you tell me your name and date of birth?
Amber Wallace, age 2777.
Okay, do you know where you are?
I'm at your house.
And do you know what today is?
Today is September 17th,
Okay, what year is it?
2013.
Okay. Okay, your face is symmetrical. I think I already said that. I'm going to feel your temporal artery. Okay, we'll go down to your temporomandibular joint and have you open and close your mouth for me. Okay, no popping. Oh, your sinuses. I'm going to feel your frontal and your maxillary sinuses. No tenderness.
Nope.
Nope. Okay. I'm going to move down to the eyes. First, I'm going to do a confrontation test on you. Let me know whenever you can see my fingers, okay?
Now,
Okay.
now,
Okay. One more.
now.
Okay. I'm going to check your light reflexes. My little handy dandy light here. Just stare. They constricted equally. Now I'm going to shine a bright light in your eyes to check your accommodation and response to the light. Okay. Bright light looking in the left pupil. Bright light looking on the right. Bright light looking on the right. Bright light looking on the left. Okay. Pupils are equally reactive and accommodating. I'm going to have you look at something over my shoulder. And then look at that. Okay. Your pupils constricted as you look toward the near object. I'm just going to kind of look at the outer eye here. Sclera is nice and white. Conjunctiva are nice and pink and moist. No obvious deformities on the irises or corneas. Pupil size is approximately 3 millimeters, and they're equal bilaterally. I'm going to do the 6 cardinal positions. Have you follow my finger, please, with your eyes. 1, 2, 3, 4, 5, 6. Okay. Eyes move equally bilaterally. Now I'm going to do a cover test where I have you hold a piece of paper and stare directly at me. Okay. And now remove the paper. Okay. And now to your other eye. And remove it. Okay. No movement. Thank you. That completes the eye portion. I'm now going to move to the ears. They're appropriate size and shape for your head. Also consistent with ethnicity, no obvious lesions. Okay, is this tender?
Nope.
In any way? Before I do the otoscope, actually, I'm going to go ahead and perform the whisper test. I'm going to cover your ear and I'm going to whisper something and have you repeat it back to me.
Okay. Apple.
Okay, now the other ear.
Apple.
Okay, very good. Now I'm going to pull up and back on the pinna and look in your ear canal. Okay, the canal itself is pink, very little cerumen. The tympanic membrane is intact and pearly white. Okay. Sorry, I'm gonna close the curves over here. Okay, again on this side, the ear canal is also intact and pink and has very little cerumen. The tympanic membrane is also intact and pearly white. Okay, now I'm going to go for inspecting your nose. No obvious deformities, no lesions on the outer part. I'm going to have you take a deep breath in as I push each side of your nose to test for patency. Okay, breathe in. And breathe in. Okay, excellent. Now I'm going to look up your nose. Okay. Skin is slightly pink. Terminates and your septum, everything appears to be intact. You don't have a deviated septum. Okay. Now I'm going to inspect your mouth. Okay. Buccal mucosa is pink and moist and intact, no lesions. Palate is intact, pink and moist. Gums are pink and moist and approximated with the teeth. Teeth are very nice and clean. And no evidence of any dental caries. Okay, can I just stick your tongue out at me and wave it side to side? Okay, tongue is also pink and moist. And open up one more time and say ah. The uvula is intact and mobile. Tonsils are at a +1, which is normal. Okay, that's it on the mouth. Moving on to the neck. Neck is symmetrical, no tracheal deviation is apparent, no obvious jugular vein distension, no lesions, masses that are apparent. I'm going to check your carotid pulse. Let's find it again. Okay, carotid pulse is palpable, smooth upstroke, no thrill present. I'm now going to go and feel your lymph nodes. Starting with the pre-auricular, moving back to the post-auricular, submandibular, submental, going back to the occipital, and supraclavicular. Okay, no palpable lymph nodes. I'm now going to come around and do your trachea and thyroid. Okay. Kind of displace with one hand, palpate with the other. Okay. No palpable masses. I can't feel your thyroid, which is within limits. also going to have you, we're just going to check your range of motion on your neck. Have you go put your chin down to your chest, put it all the way back up, look side to side, and then touch each ear sort of to your shoulder. Okay? Then I'm going to have you shrug your shoulders and push. There we go. Okay. Thank you. I'm going to go ahead and listen to your heart real quick. The 4 valves that I'll be listening to is the atrial valve, the pulmonic valve, tricuspid valve, and the mitral valve. And that's in the right second intercostal space next to the sternal border, the second intercostal space on the left near the sternal border, fourth intercostal space near the sternal border on the left, and then the left fifth intercostal space at the mid-clavicular line. Sorry. Okay, heavy lift up. Alright. And while I'm here, I'm also going to count for a full minute and rate your pulse. Apical pulse is regular and about 85. Now I'm going to go to the lungs. Watching me breathe. Thoracic cage seems like normal size and shape. No chesting. Breath appears to be unlabored. No accessory muscle use. Appears to have symmetric expansion. I'm going to go ahead and do the anterior breath sounds first. Okay. Every time I touch my stethoscope, you take a deep breath. Oh, and actually start up here. Okay. Now we have you kind of turn to the side here. And I'm going to inspect all the lung fields on the back as well. You have your upper lobes up here, lower lobes, and then you can actually do the middle lobes best on the sides. Okay, take deep breaths again for me. Lung sounds are clear and equal bilaterally. Now I'm going to do percuss just to map out the lung fields. I can tell the difference between the sounds down here. I'm going to do check for tactile fremitus. I'm going to use the side of my hand. I'm going to have you say 99, wherever you feel it.
99. 99. 99. 99. 99. 99.
I also noted while feeling around, I don't feel any masses or you don't appear to have any tenderness. Okay, now we're going to do whispered petriloquy, I think it's whenever I place my stethoscope, I'm going to have you whisper something like 1, 2, 3.
1, 2, 3.
No,
Yeah, it's
whisper.
not whisper.